Can I have a thumbs up from anybody? Lovely. Acha. Chalo guys, we'll start with today's session on our general ENT. This topic of like around 20 questions which we are going to discuss, this will be covering about the whole section of the general ENT of your basic sciences of your Scott Brown part 1. But that you all would be stressed regarding your theory results. Hai na? So that is like human nature to be stressed about it. But try to motivate yourself and keep yourself busy, है ना? So that your mind doesn't takes you back, because it's our inherent habit that we think only about negative things, right? So don't be negative. Okay? Things generally go in the favor of the person who is a hardworking guy. Chalo, let's start with the. यार भाई join कर लो please. चलो. So guys, today we'll be discussing two of the important diseases which will be troubling us during our OSCEs and even in the theory exams also. So coming to the first point, okay, there will be something sort of clinical picture will be given to you that a 36-year-old male or female comes to you with complaints of nasal obstruction. Following is the image given to you on a diagnostic nasal endoscopy. This can be also given as an image-based question. This can be given as an image-based question, or also it can be given as a small video or a GIF-based question. They'll give you something of this sort, and they'll ask you certain questions about it. So now, like suppose you don't know what is over here, what is over here, you don't know. Okay, so when you see the second line of the question, so you will be able to judge that what this question is, what the examiner wants us to answer. Okay, so when he is saying identify, or when he is saying that what are the ENT manifestations of sarcoidosis, so even if I don't know anything, I'll answer, sir, this is sarcoidosis. And what is the classical finding which is seen in sarcoidosis? That is your apple jelly bodies. Okay. Now second questions will be what will be asked to us will be ENT manifestations of your sarcoidosis. Okay, so in ENT manifestations of sarcoidosis, we can in sarcoidosis ke liye na, there is a very classical term which is being answered by the path people. Okay, see, practically, like as far as I am concerned, I am not a very big fan of path and HPE images. Okay, our work is not of a pathologist, so that I generally tell people that please ratify those HPE images which are being asked, questions being asked from path, and forget about it. Okay, so what do you mean in the sarcoidosis? Two words you should remember. That if somebody asks you, tell me something about sarcoidosis in your exam. So this is a systemic disorder. Not only an ENT thing, it's a systemic disorder which is characterized by, this is a very important word, non-caseating granuloma. Okay? This is an important word, so don't forget it. Now, how, where and all these manifest over here? See, it can cause OSA. Okay? It can cause lymphadenopathy. It can cause solitary parotid enlargement. It can cause nasal perforation. Okay? Now this is again important. Okay? Nasal perforation is classically seen in few cases. In people who are cocaine abusers, in people who have gone recurrent surgeries of the nose, and third is your sarcoidosis. Okay? Apart from this, sinonasal diseases, laryngeal diseases, all these things can be given. So people who are preparing for theory, this can be asked that what are the ENT manifestations of sarcoidosis. For it will be a sub part of a question. So you have to always answer in headings parts. If you are writing a theory question, don't write like what I have answered. No, then you have to mention ENT, like otology manifestations, nose. You have to write separately. throat may separately, and miscellaneous may you can include this lymphadenopathy, OSAs and all. Okay, got my point? Chalo, we'll move further. What is this, guys? कोई बताएगा? आजा भाई. Okay. What does this signify? I have purposefully placed this image. इसका Osce से कोई मतलब नहीं है.
Danger sign.
Yes. Danger sign. So all the first years, please remember, है ना? This question will always haunt you, and सबसे पूछा जाएगा ये question. सबसे पूछा जाएगा. Like theory में भी, viva में भी, case presentation में भी पूछा जाएगा. This can be asked as an Osce question. Universities में NBE का, even also of the MS also, it's a long answer question. ठीक है? So it is your AFRS. I'm telling the answer first, and then we'll discuss what are the questions which will be asked in this thing. Got my point? AFRS. Now the questions, I'm coming to the Osce part. Basically, I'm concerned about the Osce session, like what questions can be asked from this thing, what viva points will be there. So that I'll be discussing. See, example, sir, 30-year-old male came to you with complaints of unilateral nasal obstruction. Given is the image of his diagnostic nasal endoscopy. Okay, or again same thing as the above one. They can show you GIF based question. They can give you a small video clip sort of something, and they will tell you ki this is a very thick, greasy peanut butter type of polypoidal material which is present in his nose. Now answer the following. So this AFRS is a whole movie in itself. Whole movie means everything, and everything is a question from AFRS. Got my point? Like what is the pathology of this thing? What are the findings in endoscopy? They are a separate question. What are the findings in a CT scan? They are a separate question. Findings in the MRI are a separate question. Okay. What is the treatment? Again goes for a separate question. Okay. So 2-3 things you have to remember, and 2 classifications you have to remember. One I'll tell you today only, and one name I'll tell you. Either you tell me right now or somebody. Please, everybody will have to read it. Yeah. Bent and cone. Very good. Bent and cone. So guys, as हाँ बोलो.
Saint Paul's Center.
Please एक मिनट. Dr. Huma is speaking.
Modification of bent and cone.
Yeah, say Dr. Huma, what are you saying? I was not able to get.
Saint Paul's College classification, which is a modification of bent and cone classification.
Good. And Dr. Narang, what you were saying?
Saint Paul's only.
Saint Paul's. So these are the things. Apart from that, there will be a Shadow classification. That will be there. And bent and cone, I'll request everybody, है ना? Especially the people. रुको यार एक मिनट, एक लॉगिन नहीं किया इन्होंने. यार भाई. ठीक है. So guys, as you have remembered your date of birth, na? So like that only, please remember this bent and cone classification. It seems very easy, but there is very high possibility that you will confuse what is there in major, what is there in minor, and you will do some mistake. So that is not acceptable. Not acceptable. Okay. So I'll just coming to this thing. Okay. So there 2-3 important points are here. I'll just enumerate it. Wait a minute. Somebody is trying to log in. I'll just take 30 seconds. Oh yeah. ठीक है. So what I would like to mention, the first is your bent and cone classification. Second, the thing you have to know, remember that generally these patients are young, and second thing is these patients are immunocompetent. ठीक है. This is an important thing. These are immunocompetent patients. Normally we have this pre-formed notion in our mind that these people will be immunodeficient patients. No, AFRS patients are immunocompetent patients. Okay. So coming to this thing, this CT scan shows a classical sign. Please tell me the name.
Double density.
double density sign. And as soon as you will utter this question, second question will be, what if double density sign? Why is it seen?
The position of calcium and magnesium.
Yes, Dr. Priyanka, you are right. I'll request Dr. Priyanka again to repeat it.
Calcium and magnesium deposits.
Yeah, calcium, magnesium, iron, all these things deposit and lead to formation of this sort of sign. It is a heterogeneous signal intensity as per the words which you have to answer. This will be the words which you'll have to answer. Heterogeneous signal intensity due to deposition of metals. Okay, so you saw this thing. Now coming to this thing, can you see some anomaly in this CT scan in this section? Can anybody see this thing? ये दिख रहा है किसी को?
Breach of lamina papyracea.
Breach of lamina papyracea. ठीक है, breach of your skull base. So these two CT scans are itself a potential Osce question. ठीक है, they might give you this endoscopic finding along with it. They might just give you this CT section and ask you what is this thing. Okay, this can even be as a spotter in Osce. This can be a spotter in your table viva itself. In table viva, there is a section where there will be a laptop, and on that laptop they will keep changing the CT scan sections. Okay, so you might get a HRCT temporal bone, you can get a NCCT PNS. You might be lucky if you are given a normal thing. Generally, in the exam section, the CT scans which are kept, they are full of findings. Okay, so this is one of that CT scan which is generally kept in your examination thing. Okay, so guys, in your this is your criteria. I copied it up from Google itself, and I have one more mnemonic for this major criteria. I would like to share with you people. Do you guys know who is Nana Patekar? I'll take 1 minute of you, and the way I had remembered it, I'll just like to put it up for you. You know, everybody know who is Nana Patekar, right? So what happened once that this Nana Patekar Sahab was traveling on T1 airport of Delhi. Please remember my words. ठीक है? Nana Patekar Sahab was traveling on T1 airport in New Delhi, and he ate what? Mirchi. Hyderabad ka lal mirchi khaya. So what happens when somebody eats lal mirchi? They have this characteristic sound C C C C. They'll start doing C C C C C. Okay, and when he was doing this thing, so technically he was moving on the elevator machine, and on that elevator machine उनका पैर फिसल गया. So I'll just enumerate it over here. Nasal polyp, T1 terminal signifies your type 1 hypersensitivity reaction. CC is your characteristic CT findings. EM is your eosinophilic. Mucin, and PFS is your positive fungal smear. And what is the smear which we use? KOH mount. Okay? And in minor you can use this, or if you have anything else. This mnemonic I got from one of my senior, Chauhan sir. He is presently doing his MCH in Trivandrum College. So he was the one who made this sort of mnemonic to made us remember. Acha. So guys, I'll again advise you guys, please, AFRS, nothing you should leave behind. Like in last class, we had two topics not discussed completely, COVID and mucormycosis. You cannot leave anything from those two things. Same goes for your AFRS. You cannot leave anything from this AFRS section. Okay. Now coming to the third question. Here you will have two types of questions over here. First is your HIV manifestations of ENT manifestations of your HIV. Okay. Here we have some classical image-based questions. So we'll be discussing those image-based questions first, and then we'll be discussing what else can be asked. So I'll just come to the direct part. See, all of you have seen this image. It's from your Scott Brown itself. Okay, I've not copied anything from elsewhere, only from Scott Brown. Today only basic sciences part is covered, so I did not touch anything else. Okay, so this image everybody will be okay. Hairy leukoplakia, and this will be your candidiasis. This sort of tongue. Okay, and see this thing. All of you are able to appreciate this thing. So these three things can be individually asked as an Osce question. First, second thing, how they can be asked as what are the manifestations of HIV in the ENT per se. 2, number 3, what they can ask you? They can ask you it as your drugs based question. What are the drugs based question that we'll discuss? 3, and 4th thing, they can ask you something related to Kaposi sarcoma and all these things they can ask you. So here we should answer like this. Okay. So what else they can ask you? I'll just pick. All of you are clear? Okay. Kaposi sarcoma, everybody is clear now. Because if there is only one question to be asked from this thing, Kaposi sarcoma stands way ahead of everything. Okay. So in Kaposi sarcoma, 2-3 things you have to remember. First thing, because it is the most common HIV related tumor. First thing is that this is the most common HIV related tumor, and how does it present? It has some these sort of mucosal lesions. Or does it just present mucosal or cutaneous lesions? Okay? And how do we evaluate these patients? Same standard format, CD4 count, biopsy, and then after that management में what is the full form of heart? Anybody? Dr. Priyanka?
Highly active.
Hello?
Antiretroviral therapy.
So Dr. Narang, that will be the confusion which will make you answer wrong. Okay? Sorry, that will be the pressure which will make you answer it wrongly. Because you'll see that if that 4-minute clock is running backwards, tuck, and there will be one, write the full form of HART and classify the drugs. Okay? So it's highly active antiretroviral therapy. Okay? And how do we classify it? There are 4 sorts. First is your NRTI. This is your nucleoside reverse transcriptase inhibitor. ठीक है? इसमें तुम्हारा आ जाएगा टेनोफोबिर आएगा, zidovudine आएगा. Then you will have non-nucleoside reverse transcriptase inhibitor. इसमें you will be getting your efavirenz, nevirapine. 2 example, one example you should remember. ठीक है? Then there's something called as protease inhibitor. So examples of protease inhibitor, the most commonly used is ritonavir, and recently they have introduced your integrase inhibitor also. इसमें तुम्हारा example will be. So this can be asked also. They can give you image of example zidovudine. Okay, I'm just giving you an example. They can give you image of zidovudine, and they will ask you. First question will be, what is the mechanism of action? What is the class of heart it follows? The most common confusion is between NRTI and NNRTI. So you have to remember it like this. Efavirenz and nevirapine, they seem to be some sort of newer type of name. Zidovudine हम लोग बहुत पहले से पढ़ते हुए आ रहे हैं. We have been studying it since second years. So you can remember that this is something new, and they can ask you apart from this thing that what do you do extra in your Kaposi sarcoma? What are the other manifestations of your HIV in ENT? So these 2-3 things they can give you. So from here there is a potential drug based question also. potential drug based question. So that's why heart becomes important to you. Okay, so and apart from that, other manifestations which will be there in the ear, you will be having malignant otitis externa. Okay, malignant otitis externa in itself is a separate word of Osce's. Two important things you should remember of this thing. I'll let you know all about this skull base osteomyelitis and the classification which is there. आज के लिए याद रखना है कि malignant otitis externa is caused by which organism?
Pseudomonas aeruginosa.
Pseudomonas aeruginosa. ठीक है, you should remember it. Apart from that, ear में extra what does it cause? Serous otitis media. Then it causes nose में it will be causing nasal obstruction, sinusitis. Throat में hairy leukoplakia, papilloma, and lymphoepithelial cyst. This why I am laying measures over here, because lymphoepithelial cyst is mentioned separately in a separate paragraph in Scott Brown. ठीक है, इसका CT scan अलग से दिया है, इसका image अलग से दिया है, so it deserves that due course of respect. Why? Let us see in the other question. 50-year-old patient came to you with complaints of xerostomia. He has bilateral non-tender parotid swelling. Okay, so they can even ask you as give the DD, and they can also tell you that what will be your diagnosis. The first 8 number का question हो गया, identify. Second, when will you suspect malignancy? ठीक है, given is the CT scan of the patient. So the answer for this thing is answer is lymphoepithelial cyst. ठीक है, answer is lymphoepithelial cyst. And in the lymphoepithelial cyst, one thing is this, and second, when will you suspect malignancy? Dr. Huma बताएंगे आप?
Rapid increase in growth, sir.
Yes, something else apart from that? Let me see आज कौन कौन join किया है. एक second. Dr. Ridhima, you are there?
Yes, sir.
बताओ. Malignancy
Yes,
कब when you will suspect?
Facial palsy, the skin becomes fixed.
Yes. ठीक है. So facial, this will be your potential question with every salivary gland tumor. ठीक है, कि when will you suspect that the tumor? How can you say, Dr. Sahab, that the tumor is benign or malignant? है ना? So you have to start with this thing. जैसे पहले डॉक्टर साहब ने बताया कि there should be a rapid growth in the size. 1. Second will be the skin involvement. 2. And the 3, that is the most important, is your involvement of facial nerve. If the patient is developing facial nerve palsy, then more chances that he is having malignancy. So these images again of your Scott Brown, please don't forget. ठीक है, and people who are in first year, people who are preparing for theory, HIV manifestations in ENT is a long answer question, very 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 important. ठीक है, when if you guys are preparing for your MS exam, in that you can full that theory part, you can keep on writing 4 or 5 whatever pages you want to write. But if you are preparing for DNB, please you have to start practicing to write in a point based format. One. Second thing is your answer should be highlighted. ठीक है, highlighted मतलब examiner doesn't have, in MS everybody pass. ठीक है, in MS hardly there will be some great man who will fail, है ना? But in DNB the chances are reverse. ठीक है, you have to work hard to pass. In MS you have to work hard to fail. ठीक है, so you have to make your answer stand out. There should be some drawing, there should be a flow chart and everything. There should be like a table if you can make, whatever nonsense you can make, but कुछ तो बनाना है, so that examiner should know that हाँ इसने लिखा हुआ है. ठीक है, so these are the like nitty-gritties of theory exam जो अपने को धक्का लगा करके पहुंचना है. And believe me, the 10 questions which will be coming now, 2-3 questions will be bouncer. जैसा Osce में होता है, out of 20 4-5 questions will be there जो नहीं किसी को नहीं आएगा, nobody will be knowing them. Same goes for your theory exam. 2 questions will be like you don't know anything but still it will be there. I'll give you my example. I got the LAQ on plagiarism. ठीक है, and what all I remembered in plagiarism, my HOD once told me in a I think it was a case presentation or something like that I was presenting, and he told me that have you done plagiarism or what? He was suspecting that I have copied somebody else's presentation and was presenting it. Though he was correct, I did the same thing only, but due to this one instance, I knew that plagiarism meant that to copy something and present somewhere else, and with that thing only I made that whole answer. Getting my point? So this is the whole idea. You shouldn't leave anything blank. even in the Osce's, same goes with your theory, and whatever you write should be in a legible handwriting, should contain these 3-4 things which we have discussed. Okay, so moving ahead. So Dr. Saab, what is short? 1 marks, and what are the principles of safe transfusion? 2 marks. So one short का full form आप बताएंगे, principles of safe transfusion मैं बताएगा.
Transfusion, sir.
Yeah, Dr. Huma, I think you have read everything. We discussed it last time also. ठीक है? See, this section of your Scott Brown, na, hematology वाला section, nobody reads it. Nobody reads it. But believe me, there are very high potential questions which will be there. One is short, that Dr. Saab just told me. Serious. Second question which I'll request you to read tomorrow, not today, will be your massive transfusion protocol. ठीक है? Please read it. ठीक है? This will help you. Nobody knows when the question will come. So after the question comes, then you go back and read. That is like no fun about it. So just have a small idea about massive transfusion protocol. And the people who are preparing for theory, again, this can be your bouncer question. You write how will you manage what is a massive transfusion protocol. Okay? So please read about this thing. I'll request you. Again, same Scott Brown. There's a one flow chart of 1 page that contains everything. इतना आयन कंसंट्रेशन होएगा तो क्या करने का है, इतना ब्लड कितना देना है, कितना बीपी होना चाहिए, तो प्लीज गो अबाउट इट. ठीक है? एंड कमिंग टू these are the 4 principles of short safe transfusion. Just remember at least 1 or 2. ठीक है? I'll not say कि भैया सब कुछ याद कर लो, but at least 2-3 पता होना चाहिए. You do not act on numbers. ठीक है? You have to write the same thing and transfuse on your clinical acumen, not based on what the reports which you are getting, and consent and all. You have to see, and you have to see this thing. This is a classical word. Right blood is transfused to the right patient at the right time, for the right place and for the right indication. ठीक है? Ensure somebody can read this thing. Read this thing. कोई है? Volunteer? नहीं. So I'll read it. Ensure the right blood is transfused to the right patient at the right time in the right place for the right indication. Isn't it seeming like that वो tongue twister of चंदू के चाचा ने चंदू की चाची को, वैसे ही something it's looking like that ना? Please remember this thing. ठीक है? If God is kind on us, you will find this in your Osce, and then you'll remember me when you'll get these 2 marks. Okay. So again, moving ahead in the section of your hematology section, there is again a very good chart which is given. Not chart, this is an image, something of fancy rocket sort of diagram which is given. Okay, which can be a potential question, that what is ROTEM, what is alpha angle, or if your people they are more constipated, they can ask you what is R time, what is K time, what is alpha angle, on that sort. So ROTEM stands for rotational thromboelastography. ठीक है? So guys, this has already been asked in your theory question as a part of long answer question. ठीक है? कि what is ROTEM and why do you do ROTEM? What are the advantage? So the advantage goes following, that this technology gives a quick guide to the global coagulation function, indicating the patient's current status, and also it will be providing information to the formation of clot and its stability. ठीक है? So you should remember these 2-3 things about ROTEM also. Now, again coming to a image-based question. So what will be the first thing which you will see in this image?
Expiry date.
हाँ, please, very good. This is the same thing. ठीक है? अभी अगर इसको देखा जाए, if you can see, this is not clear. So if the DNB people will be giving some image, and if they want you to focus on that expiry, तो यहाँ पर see somewhere यहाँ पे जो expiry वाला which is section which is not clearly visible, it will be visible very clearly that the thing is expired. Okay, so where is this autoflower used?
Autosclerosis.
ठीक है? Mechanism of action, mechanism of action again remains the same, that it's enzyme inhibitor, and this I'll write all the PDF and send. Okay, don't worry. See, this reduces your osteoclastic bone resorption, and important thing is what is the dosage. यहाँ पे फंसेंगे हम लोग।
Dosage is giving पहले एक इनिशिएशन डोज देते हैं 50 to 75 मिलीग्राम पे, फिर एक मेंटेनेंस डोज 25 पे देते हैं शायद।
हाँ, तो इसको एक बार दोबारा पढ़ना है सबको, ठीक है? ये आज का फिर से एक टारगेट है, बिकॉज स्कॉट ब्राउन इज वेरी इंपॉर्टेंट फॉर यू, बट आई विल से दैट दिस इज द मोस्ट कंफ्यूजिंग बुक आल्सो, ठीक है? एट द दे विल गिव यू होल कहानी, एट द एंड इट विल से दैट द थिंग हैज नो यूज. So in the Scott Brown they are mentioning two figures, that in this dose it is causing this disturbance, this is the causing this disturbance, ठीक है? In the end they are mentioning a dose of 16 milligram per kg, 16 milligram per day for 2 years, ठीक है? So I'll request everybody to read today about medical treatment of otosclerosis. See, otosclerosis is a diamond, है ना? हीरा क्वेश्चन है तुम्हारा otosclerosis. It gives you that theory वाला सब पूछते हैं. Surgery में तुम्हारा stapes again goes, everybody asks it, and even the medical management, this sodium fluoride, bisphosphonates, this is a very potential question, ठीक है? So please read about this 60 milligram per kg. I only read Scott Brown today again, so if anything extra you get it, please update in the group, ठीक है? I'll request everybody कि please update, please keep on discussing, ठीक है? Now the second question is, what is Mofat solution?
10% cocaine.
It is 2 ml of 10% cocaine, 1 ml of 1:1000 adrenaline, 2 ml of sodium bicarbonate.
बोलो रख लो, ले लो।
वाह, great. And maximum dose is 1.5 milligram per kg, ठीक है? So you have already mentioned it. So see, this is what Scott Brown mentions, ठीक है? 2 ml of 5% cocaine, 1 ml of 1:1000 adrenaline, and small amount of bicarbonate, and this is the maximum dose which is available, ठीक है? And see, this was what I was mentioning. They have mentioned multiple things, that this is caused for falana problem, and this is the dose which they mention. Benefit in 50% of the patient in 5 years after 2 year treatment with sodium fluoride, dosage of 16 milligram per day, ठीक है? Sure. Again, coming to this question, what is ERAS? Enumerate the principle of ERAS. So one thing you will tell me, one thing I will tell you, ठीक है? I request that हम लोग इस तरीके से ये थोड़ा सा इंटरेक्टिव रखते हैं, because ENT itself, the clinical part is very interesting, theory is very boring, general ENT again very boring, है ना? So थोड़ा इंटरेक्टिव रखते हैं, है ना? So किसको परेशान किया जाए? Dr. Chaitra, are you there? है ना? चलो let give it a try. What is ERAS?
Enhanced recovery after surgery, sir.
अरे great. See, that was a बोल सर. Enhanced recovery. And guys, if anybody is like they don't want to answer, na, so just drop me a message. I'll not answer. I've just logged in like that only. I'll not trouble you. Okay, it's just like to keep on little bit of interaction type of thing. Okay, so these are the principles of ERAS. Okay, please remember it. Again, see, I told you hematology is important section, and this general anesthesia section of our ENT is again also important. Okay, so please remember, they can very easily ask you what is ERAS. Okay, enumerate principles of ERAS mentioned, and third thing, recent advances में भी है jet ventilation, ठीक है? आज का तीसरा to do thing हो गया, ठीक है? We'll read about jet ventilation also, that principles of jet ventilation, 2 images are there in jet ventilation, ठीक है? Now see, I found these, there is no practical theory thing about these two things, but I found these named images, so that's why I included them. Okay, this is your Ravusin style cricothyrotomy cannula, and this is a Sanders injector. Somebody is trying to log in now. अब क्या करोगे log in करके? Welcome, Dr. Thesina. ठीक है? So these are the two things: Ravusin style cricothyrotomy cannula, and second will be your Sanders injector. Please remember these images. ठीक है? Now again, third, this is your laser safe. This tube, this name of this tube is whatever you like to pronounce it, Hunsaker tube, ठीक है? Please don't forget the image, and this thing will be your metal spiral armored laser tube. Now, can you see this thing? This is something new about this tube, something different. I'll not say new, this is different. What is the purpose of this thing? Can somebody enlighten?
It is filled with methylene blue, sir.
Yeah, it is inflated with saline or methylene blue. थोड़ा और enlarge कर देता हूँ. क्यों भरता है? क्या करता है?
डबल
हाँ, डबल क्यों है? Because they will ask you कि वहाँ पे ये नहीं होगा, इतना क्रॉप करके रखा होगा, ठीक है? And clock will be ticking, टक 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 पीछे आ रहा होगा, and you will be having lots of pressure. And अगला क्वेश्चन होएगा कि where is it used? One. Second thing, what is the purpose of this twin cuff? Somebody give it a wrong try. बोलो कहाँ पे यूज करेंगे इसको?
In laser surgeries and if anyone any cuff is ruptured, it will other will save the purpose.
Save what purpose? किसको बचाएगा? That is the question.
Secretions from the
exactly. ठीक है. So in your laser, one problem will be there of that laser ignition, the fire ignition that happens. Okay, so this provides as a second layer of protection. So even if your proximal cuff is damaged by laser ignition, the distal cuff, ठीक है, this will remain intact and the patient will be okay. ठीक है. It will not be there कि पूरे ही cuff फट गया, आग लग गया and patient also gets the problem. So that is your purpose of your twin cuff. So okay, you will be able to write this much, है ना? We need 1 mark from this question, so we'll be okay from this laser. ठीक है. Again, two very important questions. This is very important. पहला वाला तो नहीं है, ये वाला. What are the classification of level of evidences? ठीक है. Everybody would have studied it.
7, yeah.
है ना? There is no fun in telling, but if you have not studied somehow, please rectify it. Please. Very important. हर जगह पे पूछेंगे तुमसे, जैसे ही तुम अपना थ्योरी बोल रहा हूँ, थीसिस as they will ask you what was your thesis topic, thesis का वाइवा will start from this thing only. अच्छा, what if this, what you have done your अच्छा, what if this cross sectional study, what if this study, अच्छा, what are the evidence based classification, please tell me. So from there only it will you'll be taken this thing, what is expert opinion, what is case control, what is cohort. We'll be discussing it separately, but please don't no chance of forgetting it. ठीक है. Coming to what is spikes and where do you use it, ठीक है. So this is the
breaking bad news.
Yes, breaking bad news. ठीक है. So I'll highlight the same only that thing, breaking bad news. Full form ये लिखा हुआ है, please रट लेना, है ना. Exam में if it comes and then you start what to say, accusing yourself that I didn't study that, so that's not a very good thing. So please read about, not read, only just remember what is spikes. ठीक है. Give it a try आज शाम को and same thing tomorrow morning. You will not forget it. ठीक है. And we'll be accumulating it, all these acronyms at one place. जो daily का हम लोग acronyms कर रहे हैं, so at the end of this 1.5 month, so you will be having around 40-50 acronyms which are most important and they will be asked to you. So please remember it. Okay. अच्छा, we remember today short we saw. Apart from that, area has been asked. This question has been asked. Okay, I'll just write it. Sorry, this not writing in the exact place. This full form has been asked. This question has been asked. ठीक है. So कौन बताएगा भाई? कोई बताएगा?
Allergic asthma pattern cartilage based nucleic acid amplification test.
ठीक है. Great भाई, great. ठीक है. So please remember it. Don't forget it. ठीक है. This has already been asked. अपने मन से नहीं बोल रहा हूँ. I'll share the OSCEs also. एक नंबर का पूछा हुआ है. ठीक है. And believe me, this 1 mark is very important for passing. ठीक है. When you will be aiming for that 50% ना, that 1 mark is very important in passing. So these are the things you shouldn't forget. ये एक नंबर से करके अपने को 50% आराम से क्रॉस होना है. Because there will be certain questions जहाँ पे अपने को कुछ नहीं आएगा. ठीक है. So वो nothing can be done about that. Okay. चलो. Coming to this thing, this has already been discussed once. ठीक है. Just see this image. This is your copper beaten skull appearance. ठीक है. This is your copper beaten image again from Scott Brown. This thing Scott Brown, this thing Google. ठीक है. So just to collaborate it. So where is it seen? कहाँ पे दिखता है?
increased intracranial pressure.
Yes. ठीक है. And after this ICP, they can ask you in which all syndromes it is seen. So you can answer anything, Cruzon, effort, whatever you want to answer. 1 or 2 syndromes you should be ready to answer it. Okay. Acha, one more thing which you can do. See, 90. If this question is being asked, so 90-95% chances is there कि अगर उनको copper beaten skull पूछना है, तो they will ask from the image which is given in your squadron itself. ठीक है. But if you are unlucky, so they might give some other image. So what I'll request or what I'll advise you guys to do is, whenever you are sitting free with your mobile phone, in the Google type it copper beaten skull appearance, and top 3-4 images what is there na, just keep on flipping through it. Okay, don't leave it key only one image, keep on flipping through 2-3-4 images, and when you will see copper beaten skull na, so Google will be kind enough to give you 1 or 2 questions more. Achha, you are finding copper beaten skull appearance, they'll give you 2 skull more. Okay, this is one more skull seen in some other anomaly, some article it will give you, some disease syndrome name it will give you. Okay, so please don't forget it. Okay, achha, one more thing is there again, please
culture.
yeah, culture. The name, the main purpose of putting this image over here is to remember the name, nothing else. Okay, this method is called a disk diffusion method of susceptibility testing, and this is determination of your minimum inhibitory concentration by diff test. Name of diff test is e-test. ठीक है, इसके अलावा कुछ पढ़ने का इसमें जरूरत नहीं है. ठीक है, so after completion of this thing, your basic sciences all OSCEs are completed. ठीक है, I'll again reiterate, I'll again reinforce, AFRS is very important. Please don't forget it, whether for your practicals, whether for your Viva OSCE thing or for your theory. Okay? Please read in toto, in depth about your this thing, AFRS. Please don't leave. जैसे पिछली वाली क्लास में vestibular schwannoma था, it was very important. Everything you should know about it. Same thing goes about your AFRS. Please don't forget anything. Now, again, extra 10 minutes will be there for BPPV. If somebody wants to ये क्या कहते हैं log out करना है, तो please you can log out and ये कर सकते हैं. ठीक है? So this will be there for the people who are there in first year. And I'll request again one thing कि जो लोग first year से हैं, please drop me a message once again, because 2-3 questions were there from their side, so that I can again reinforce them. अच्छा, coming to your BPPV, ठीक है, BPPV में 2-3 things you have to remember. ठीक है, this will be only the basic sort of stuff, not very much related to the OSCEs. If you want to continue 10 minutes more, if you want to break off, I'll request you can just break off. ठीक है. ठीक है, तो you should remember the people who कि approach to your vertigo thing ना. See, approach to vertigo depends upon 2 things. First thing is your history. Second is your clinical finding. And third thing, whatever examination or treatment which you would like to do. ठीक है, so how to approach है ना. This is nothing related to any scientific data. This is all what you generally advise in your emergency section. ठीक है, so 90% of the time the peripheral vertigo which we have, we are dealing with BPPV itself है ना. So when we divide it into 2 things, peripheral, central, तो ये तो चला गया मेडिसिन के पास. अपने पास जब भी आता है ये पेरिफेरल, तो मोस्ट इंपॉर्टेंट थिंग विल बी बीपीपीवी. causes of peripheral vertigo, one is BPPV, second is your vestibular neuritis, third is your labyrinthitis, fourth is your Meniere's disease. ठीक है, Meniere's disease, we read so much about Meniere's disease, but it's very uncommon. Hardly you'll see one patient like in our setup, the impact of this disease is very less. ठीक है, so whenever a patient is of peripheral vertigo, we have to keep our मोटा our evaluation will be leading to these 3-4 diseases. ठीक है, in the BPPV basically 2-3 things you have to see, that the vertigo which is there, it is rotational, paroxysmal है ना. The patient will be okay in between. He'll say that chakkar aaya, it was there for few seconds, and after that I became okay है ना. Apart from that, the word which Scott Brown mentions is walking on pillows. कि चलने में मेरा बैलेंस नहीं बनता है. ठीक है, 2. And third thing will be इसके बाद जब इफ यू सस्पेक्ट कि हाँ इसको पेरिफेरल है, तो पेरिफेरल में यू विल सी द निस्टैग्मस व्हिच इज डिफरेंट फ्रॉम योर पेरिफेरल एंड सेंट्रल, दोनों का निस्टैग्मस अलग अलग है, ठीक है। तो उसका जो classification that we'll see in Ewald's law and Alexander's law, that is entirely different, ठीक है। And second thing which can be asked is what is the etiology of BPPV। अभी सारा फोकस हमारा BPPV पे है, ठीक है। और BPPV में the patient will be stable, he will be comfortably sitting, he'll say कि sir when I do this particular thing then only I have chakkar, जबकि this thing vestibular neuritis patient will be lying down, he will be having severe vertigo, he gets up, he vomits and he again lies down. You will not be able to properly examine this patient also, vestibular neuritis, and this patient generally mimics central cause, in which you will be having this confusion that whether this guy is having central cause or not. In labyrinthitis, since the labyrinth is involved, so there will be associated hearing loss also, ठीक है। And Meniere's disease everybody is expert, ठीक है, कि this will be oral fullness which will be episodic blah blah blah, ठीक है। But this is very uncommon, so and believe me, uncommon diagnosis patients also present very rarely. So whenever patients present to you, your chronology or your order of suspicion should be the following: BPPV, then vestibular neuritis, labyrinthitis and Meniere's disease. And what are the etiology of BPPV? This is for the theory purpose, not for the practicals, ठीक है। Generally it follows trauma, it follows vestibular neuritis, ठीक है। it follows Meniere's disease, Meniere's disease के बाद में BPPV हो जाता है, it follows otosclerosis, ठीक है, and it can be associated with migraine also, okay। So 2, number 3, जो posterior, horizontal और anterior होता है, posterior is 93% common, this is the data of Scott Brown, ठीक है। horizontal is 5% common and anterior is 2% common, so you should be well versed with posterior canal BPPV, है ना। what are the indications, what are the etiologies you should know, you should be knowing for writing a long answer question. BPPV in itself is a long answer question also, ठीक है। what are the etiologies you should be able to answer, what is the pathology behind it, so the theories of cupulolithiasis and canalolithiasis we have to write. 2, number 3, how to evaluate, तो evaluate में clinically Dix-Hallpike, apart from that further में फिर आपका ENG VNG उधर चला जाएगा। 3 और चौथा हो गया ट्रीटमेंट में तुम्हारा कैनाल रिपोजिशनिंग मैन्यूवर है, CRM, ठीक है, कैनाल रिपोजिशनिंग मैन्यूवर। सो कैनाल रिपोजिशनिंग मैन्यूवर ऑफ योर पोस्टीरियर कैनाल BPPV, posterior canal BPPV में we will be having Epley's, and in Epley's what data Scott Brown mentions is 80% resolution. Apart from Epley's, second maneuver which you should knowing about it is Simon's maneuver, 2, इसमें the number which Scott Brown mentions is 93% resolution, 2 हो गया। and the exercise which is prescribed in BPPV, that name of that exercise is Brand-Deroff exercise। यहाँ पे कंफ्यूज नहीं होना है, Brand-Deroff एक्सरसाइज BPPV के लिए है, कॉथॉन-कुक्सी एक्सरसाइज हमारा वेस्टिबुलर न्यूराइटिस के लिए है, ठीक है। दोनों अलग अलग एक्सरसाइजेस हैं, तो नेम्स आल्सो यू शुड बी रिमेंबरिंग सेपरेटली, ठीक है। ये हो गया। अच्छा, दिस क्वेश्चन इज अगेन अ पोटेंशियल क्वेश्चन, व्हाट इज इवॉल्ड्स लॉ एंड व्हाट इज अलेक्जेंडर्स लॉ, प्लीज डोंट फॉरगेट इट, ठीक है। दिस इज फ्रॉम स्कॉट ब्राउन इटसेल्फ, ठीक है। तो दिस यू शुड बी रिमेंबरिंग, व्हाट इज इवॉल्ड्स लॉ, व्हाट इज दिस लॉ, अलेक्जेंडर्स लॉ। अच्छा, कमिंग टू अनदर नेम्ड क्वेश्चन, और ये हो गया पोस्टीरियर कैनाल। इसके लिए अपने को इफ यू डोंट नो, you will be knowing how to do Epley's and all, नहीं आए तो इसको YouTube पे डाल करके देखना है, what are the Epley's maneuver, what is Simon's maneuver। Scott Brown पढ़ के नहीं समझ में आएगा कि वो how do you do Simon's। horizontal canal BPPV में you have to remember three names which you have to write in your theory. First is your forced prolonged position, healthy side. Second is your 270 degree barbecue, 360 degree yaw rotation, very less common, ठीक है। 93% के बाद ये 5% हो जाता है, so you will find patients but less commonly, ठीक है। So you should be again see the videos of these things from YouTube, I'll share link of all these again. And coming to your anterior canal BPPV, this is very less common, इसके लिए modified Epley's करते हैं, I have not seen anyone till date, and horizontal BP I hardly 2-3 patients till in last 5 years I've seen of horizontal BPPV. ठीक है. इसके अलावा for your better understanding, these 2-3 this is what I followed. Sujata ma'am's video you can see. Initially they were given in some another manner. Abhi they have divided it into part 1, 2, 3, 4, 5 करके दिया हुआ है. So this you can see anatomy of your labyrinth, both membranous and bony. Inner ear can anatomy पढ़ना है. Second thing will be your BPPV. Second video है कि how to answer about BPPV. ठीक है. So these 2-3 things you should remember about BPPV. तो तुम्हारा theory में जो पूछा जाएगा, the questions which will be asked in the theory, they will be covered, and clinically BPPV में you have to remember these 3-4 points of the history. One thing is it will be positional, है ना. Second will be paroxysmal. So if the patient says कि sir I am having continuous chakkar for last 24/7 for the last 1 week, that cannot be BPPV. However, we have to give the same medication and treat it accordingly, but ideally it should not be BPPV. It is not paroxysmal. That is like was just indicated. ठीक है. And second thing will be it plus minus nausea will be there, and third thing will be time duration, है ना. The chakkar of this BPPV is only from seconds, maximum seconds to minutes. It cannot happen that the patient is having continuous giddiness, severe giddiness that he is not able to get up from bed. If he is having severe giddiness, not able to get up from bed, continuous vomiting, your more favor goes towards this vestibular neuritis. इसको next class हम लोग पढ़ेंगे कि how do you treat vestibular neuritis, what test, HENTS हो गया, SKU हो गया, Cawthorne-Coxie exercise हो गया. All those names we'll be discussing in the next session which we'll be meeting. So today was dedicated to some sort of BPPV. इसमें please go through about it, and the guys if you have any confusion, I know that this will not suffice at all. ठीक है. So please keep pinging me up. I'll never get ये कि why you are sending message. Please keep dropping the messages whatever problem you are having. Okay. So guys आज के इसमें किसी को कोई issue, any issues which you are having from today's class? No. And
so what was the name of the double cuff tube?
There is no particular name which is given in the no. It just mentions that metal spiral armored laser tube. Okay. They mention that note the twin cuff. This can also be asked again in the question that how do you inflate it? Because in the laser, this is one point. We do not inflate it with air.
Okay.
Normally what happens कि normally whenever we put endotracheal tube तो सीधे उसको air से ही तुमने bubble फुला दिया. ठीक है. But this is the difference over here. We do not inflate it with air. So this can be one question कि how do you inflate it? What do you fill in it? And second, what is the purpose of twin cuff? As far as name, I couldn't find any name for this particular tube, twin cuff. ऊपर वाला जो tube था laser safe करके दिया है, that is Hunsaker tube. That name you can remember.
Okay, sir. Thank you.
Any other point from anybody?
Sir,
बताओ.
Sir, in vertigo, can you tell us about the nystagmus, sir? What is the fast phase and slow phase? How to look for that? And,
see, I'll share the exact videos for that. How to look for a fast phase of the nystagmus and slow phase, that cannot be shown in the PDF format. Okay, so I'll look for some self-explanatory videos, and I'll share it in the group. And second thing is कि in the next class which we'll be having, we'll discuss on that nystagmus wala part. I'll note it down. Okay. Any other point from anybody? Lovely. Okay, I'll share this PDF and hopefully this will also get recorded. So we'll put it so in case somebody of you misses it, you can see it along. Okay. Any other points? Please do keep messaging me. No issues. Okay. Chalo, have a good night. All the best. Bye.
Thank you, sir.
ये दो तो अभी भी ज्वाइन है, ये राज पुष्कर और ये जो भी है।
तो स्टॉप कर दे।
हम तो स्टॉप कर देंगे, अभी भी ज्वाइन है, हम ये कह रहे हैं।